Hi. So one of the questions that I get asked the most is, what is the difference between osteoarthritis and rheumatoid arthritis? My name is Dr. Dada. I help people with joint pain who have concerns about long-term damage to their joints, preserve joint function so that they can live an active life. So let's get to it. What's the difference? So a simple way to look at it is that osteoarthritis is the kind of arthritis that we'll all get eventually if we live long enough. So it is wear and tear to the cartilage. Rheumatoid arthritis, on the other hand, affects a select group of people. And rheumatoid arthritis is an immune-mediated disease, so an autoimmune disease. And in this case, the immune system, which is supposed to protect us from invaders, there is something that goes horribly wrong, and instead of protecting us from invaders, it is attacking our joints. So 5 main differences, I would say, between osteoarthritis and rheumatoid arthritis. So if you think, well, osteoarthritis, who's going to get it? The older we are, the higher the risk of getting osteoarthritis, of developing osteoarthritis. If we've had injuries to joints in the past, if we're carrying excessive weight, these things put us at an increased risk of developing osteoarthritis. Rheumatoid arthritis, on the other hand, can affect anybody, any age. So even children get rheumatoid arthritis. Then the next question is, well, which joints get affected with osteoarthritis? Typically, the base of the thumb is number one, because there's really nothing you can do with those fingers if you don't use that opposition action from the thumb. So the base of the thumb, hips, knees, and the base of the first toe. People refer to that as bunions. So that is osteoarthritis. Rheumatoid arthritis, I like to think about it as a bully. It loves the tiny joints. So typically loves the knuckles, this joints out here in the middle. It loves the wrist joints, and it can affect any joint in the body, but also kind of the base of the toes. Because rheumatoid arthritis is more of an inflammatory process, people can have significant fatigue, which does not necessarily occur with osteoarthritis. And then stiffness in the morning. Again, inflammation tends to accumulate when we've been immobile. So people with rheumatoid arthritis tend to be stiff for hours. Typically, it's almost at noontime before they feel like they've really kind of loosened up. People with osteoarthritis may feel stiff, but typically a few minutes, you hop into the shower, you feel better, that kind of thing. That's more osteoarthritis. And then rheumatoid arthritis can also present with more systemic problems. So people may feel anemic, there is fatigue, they may have skin lesions, they have dry eyes, dry mouth, and those things typically don't occur with osteoarthritis. So the good news is that with either of these conditions, one can live an active life. So get on a treatment plan with your doctor. Call us at Overlake Arthritis Osteoporosis Center. Like this video, share it if you think it's been helpful. If you contact us and you're in the Northwest area, we'll be happy to help you on your journey towards healthy joints. Take care.